I want to get back to the measles outbreak in Maryland now. Among 3 counties, the disease, as you know, especially dangerous for older people and young children. Multiple outbreaks happening at schools in other states as well. Drew Unk's on your corner tonight in Carroll County, breaking down what parents need to know about protecting their kids. Drew.
Yeah, Rick, to be clear, the Maryland Department of Health wants to make sure it is known that they do not believe that there is any widespread community transmission of the measles. But most of these cases that have been confirmed in Maryland have had to do with specific households and contacts within those households. Still, as of today, there have been 31 cases confirmed in Maryland, which might not seem like a lot, but 27 of those cases have been reported since July 15th, and all 27 of those cases were found in people who were not vaccinated. Now, the 3 counties where they are seeing the most cases are St. Mary's County, Carroll County, and Cecil County. Those are the places where the outbreak has been declared in Maryland. Now, health experts say the risk to people who are vaccinated is extremely low. But with kids headed back to school, health experts say making sure they are properly vaccinated is key.
So I'd encourage people not to panic, to know that there is an intervention that works against the contraction of measles, but to, certainly to seek that intervention, because measles is not, just a benign illness. And it is associated with a variety of complications, and it kills a lot of children worldwide. Even though most people in the United States do recover when they get it.
And just to let you know how contagious measles is, according to health officials, if someone is not vaccinated and they come in contact with measles, there is a 90% chance that they will become infected. On your corner in Westminster, Drew Unkst for WJC.
Drew, thank you.